Hey guys, so I decided to do my article presentation on transcatheter aortic valve replacements in bicuspid valves versus tricuspid valves. And this information comes from the Journal of the American College of Cardiology. And typically we have 3 leaflets in our aortic valve. However, some people only have 2 leaflets. And this study actually told me that 2% of the US population will have that bicuspid aortic valve. And my brother happens to be part of that 2%. So he was born with 2 leaflets in his aortic valve, where we're supposed to have 3. So that just means that those valves were allowing blood to flow back into the heart from the aorta, which is a pretty big deal. And to correct this, he had to have a valve replacement surgery, and that's done by cracking the chest and performing an open heart surgery, which is a pretty major surgery. And that's always been the standard for these patients. But this TAVR, and that's what's short for transcatheter aortic valve replacement, has always been used for tricuspid patients, so maybe patients who've had stenosis or anything along those lines, and has always excluded bicuspid aortic valves. But this study that I found has introduced using this procedure for bicuspid aortic valves. So they took 932 people that had the bicuspid aortic valve and performed the TAVR on these patients. These patients were considered high risk, and that's the whole reason why they chose these patients, because they were high risk for surgery. So the minimally invasive would have been their better option. So they compared the results from people who've had the TAVR with the bicuspid to those who've had the TAVR with the tricuspid, and they found that the death rates were similar from any cause. So once they've come out of surgery, their rate for stroke or rate for heart attack or just whatever were similar among the two. And the lead researcher on this article said that this study suggests TAVR is a viable option for patients with bicuspid valve disease who are at high surgical risk. My brother was not at high surgical risk, so he had the open heart surgery, which is still the standard. This is just introducing this surgery for those who are considered high risk for surgery. But it kind of paves the way to think that maybe they could possibly find a similar surgery or even modify this surgery to where it can be done for patients who have that bicuspid valve and need a replacement. And maybe instead of them having to crack the chest and do a open heart surgery, they can do it minimally invasive. And that would obviously be great, because the healing time from a minimally invasive surgery to where they crack the chest is going to be drastically different. So I found it really interesting. I hope that they will continue to research this and see what else they can find about it. My brother has now a mechanical valve. So when it was 2010 when he had his first surgeries, and they gave him a PIG valve, and now he has a mechanical valve because in 2017 they went back and gave him that mechanical valve. So now if you're just sitting around and it's quiet, he ticks like a clock. So, it's really cool actually. I think it's super cool. And I'm going to put some pictures of him at the end of this so you guys can kind of see how major of a surgery that is, and just kind of like emphasize how cool it would be if they could make this minimally invasive. So, thank you. I really hope you guys enjoyed it.